The panel is on Health 4.0, a vision for smart and connected healthcare and digital hospitals of the future. For this panel, it's my pleasure now to invite the panelists on stage. Can we have Dr. Rakesh Gupta, Chairman, Sarvodaya Healthcare? Dr. Rakesh Gupta. Okay, he might be outside, so let Dr. Gupta join in. Then we have Dr. D.K. Gupta, Chairman and Managing Director, Felix Hospital. Yes, sir. Can we have a round of applause? Can we have on stage Commander Navneet Bali, Senior Vice President and Group Head, Narayana Health? Can we have on stage Dr. Samir Singh, VP Clinical Services, CK Birla Healthcare? I'd like to welcome Neelesh Shinde, Group Chief Technical Officer, Jupiter Hospital. There he is. Dr. Biren Chauhan, Group CEO, Sunshine Global Hospitals. Saurabh Gupta, Regional CEO, Kim's Hospital. Ekta Modi, CEO, Parul Sevashram Hospital. Then from the solution provider side, can we have Bhupesh Arora, Business Head, Digital Energy Division of Schneider Electric? Dr. Anil Muniyappa, Head Healthcare Transformation at Cloud4C. And is Dr. Rakesh Gupta inside the hall? Okay. Yes, sir. Great. So primarily, the focus is on Health 4.0 and digital hospitals of the future. So I will start with you, Dr. D.K. Gupta. When we talk about Health 4.0 technologies, we talk about applications around artificial intelligence, Internet of Things, and during the morning inaugural session, we heard quite a few applications of AI in the healthcare sector. Even IoT also we heard about. And during the earlier panel discussion, there were talks about measurable business outcomes. So my question is, how can some of these Health 4.0 technologies, AI, IoT and the likes, how do they improve the patient outcomes? Because ultimately that is the aim of any digitization in the healthcare sector. And how can it enhance the overall quality of how healthcare is being delivered?
Thank you so much and good afternoon to all of you. And thank you for being here. I think the prime objective of any treatment given to patient is first, quality of treatment, second, safety of treatment, third, patient experience. If we talk about AI, IoT, or any other things like robotics, artificial intelligence, beside that, AR, augmented reality, VR, virtual reality, or we talk about machine learning, they all contribute to the patient's ecosystem in different forms. If we talk about AI, definitely AI helps in predictive, as you were speaking just before this session, prediction of disease, risk factors, prevention of them, early diagnosing, screening, and in treatment also. They are helping in all the stages of 4 or 5 stages of patient treatment. There is a process of treatment. It starts from predictive, preventive, and early diagnosis and treatment. Finally, the prognosis and outcome. We can enhance outcome of treatment process at each step with the help of AI or IoT, or integration of all the equipment with AI or IoT, so that different parameters, different risk factors, different sign and symptom, different diagnostic results, they can be integrated. And based on this integration, the doctor can be empowered to take wise or precise decisions. So that diagnosis is good, and the precision of diagnosis is good, treatment is precise, is specific, targeted, and the outcome will be definitely good if we use all these technologies in the treatment process. Thank you so much.
Okay, thanks. Exactly for setting the tone of the discussion. Commander Bali, I'll come to you with the same question. Basically, how these so-called Health 4.0 technologies improve the overall healthcare quality in terms of what healthcare is being delivered to the patients.
Thank you so much for inviting me here today. And I think these post-lunch sessions are very interesting because I think everyone is trying to keep awake, but I'll make it a little interesting for all of you. So we have a very broken healthcare model today in India. If you really look at it, you just cross the borders of Delhi and move towards cities, the smaller towns and cities. You will see that disruption has happened in almost every walk of our life. You know, IRCTC enables everyone sitting in one remote village in Tripura or Jammu Kashmir to book a ticket. Aviation has been disrupted. We do it in a very fine manner. Your movie tickets, the whole ecosystem is disrupted. Everything from food business to everything is disrupted. Look at healthcare now. I think we are far from even looking at the tip of the iceberg. We talk about AI, we talk about IoT, we talk about all these technological advancements, but again, at the user end, it's quite chaotic. The hospitals have got thousands of applications running. The users actually are quite confused. At the patient end, again, it's quite chaotic because despite the fact that we have so many of these advancements happening, but still, today also you go in a hospital, you have patients fighting over a bill, you have chaos in the OPDs, both in the public and private healthcare systems. So we are far from where we should be, even though that we do talk about a lot of technological advancements. Look at the medical part of the story, where, as you remember, there was a software called IBM Watson many years back, which sort of wanted to make medical oncology treatments based on algorithms of many data which were taken from the Caucasian genes, and they wanted to be very specific onco treatment. But then I think it was slightly ahead of its time. But in that part of the medical paradigm, you have got huge advancements which have happened. So you have robotics coming in, you have doctors who are today treating patients with more easier ways. There is less blood loss, less pain. We have genomics coming in. We have a lot of advancements which have taken, which actually have contributed immensely to the overall outcomes of the patient care. The last bit of the ecosystem, which is again chaotic, is there are three main players as far as the healthcare ecosystem is concerned. There are the hospitals, there are the patients, and there is the insurance. And all three of them don't, trust each other. The patient doesn't trust the insurance company doesn't trust the patient doesn't trust the hospital. And, there is a huge amount of mistrust. Just to compare with aviation industry, when you sit inside an aircraft, you don't ask the pilot, how much aileron or how much rudder will he use when he has to bank 30 degrees, 40 degrees. But all of us are very well, educated today. We go on the Google and, try to look up every disease and every treatment possible. The reason is because there's a huge amount of mistrust. So in my viewpoint, as technology advances, first of all, there has to be a complete sense of a seamless, evolution where the true disruption in healthcare will happen, which we are very far off. The second important revolution which will happen in healthcare is the revolution of trust. And I think that will be driven primarily in India by insurance, because when the patient doesn't have to pay from their pocket and someone else is paying for them, that will disrupt the entire healthcare industry. That's all as of now. Maybe we'll talk more.
Okay. The insurance part of the healthcare ecosystem, as you rightly said, is a critical aspect, and maybe we might be slightly glossing it over today's discussion for paucity of time. Um, so I'll connect this Health 4.0 with how a digital hospital would look like in the future, and come to you, Dr. Samir Singh, with the question of, if we extend these digital technologies, AI, IoT, then we talk about patient portals, different kind of mobile applications. So, in a digital hospital, within quotes, what we mean by digital hospital, how can these technologies, in your view, improve the patient experience, and more importantly, uh, just not the experience, but at an affordable rate? And one important thing, one of the panelists mentioned, the moment we are going beyond Delhi, or so in hinterland, our connectivity, it's not uniform, the quality of connectivity, if we may say. So when we are talking about adoption of these technologies, how would you factor in things like the cost and the quality of connectivity also?
Sure, sir. Thank you for the question. A very good afternoon to all of you. I'll keep it simple, sir. I think your question, if I have to look at the entire gamut of patient experience, safety, quality, I would also call clinical outcomes, governance, things like this integrated together. What There's so many apps, there are so many mobile applications, there are so many portals, there are so many, I think, sites, tools, AI tools available. I think the hospitals, based on its capacity, has to think what is vital, what is essential to them, and what is desirable. So what is vital to a patient if it's a small niche hospital and diabetes, management or diabetes care, or antenatal if you're a niche specialty of women and child healthcare space, or you're a boutique hospital. Probably if you would like to look at something which enables only those, their prenatal to, reminders, they have had food, nutrition, there are tools available to monitor your diabetes care plans, things like this. So if you're a single specialty or maybe a surgical super specialty hospital focusing on that, so just the preoperative preparedness, post-operative, how you're standing, infection control being checked, your implants, are they doing fine, your AI outcomes. As a clinical governance team part, maybe I would like to have my dashboards, which I could publish on my website. People in US actually make a choice. So if there's a society called as Society of American Gastroenterologists and Endoscopic Surgeons, SAGES. So there, every endoscopist has to put up their data on month-on-month basis on what is their polyp detection rate, how much time they spend in a colonoscope, how much time do they take to withdraw the colonoscope, and based on that, the patient makes a choice on whether the doctor is great or not. If you look at Saudi Arabia, there even doctors' credentials are embedded in, because they're already there. They're all, say, maybe 14 hospitals are all JCA accredited. So what next? So based on the credentials of the doctors, the OT doesn't take that code inside. So I don't have to have a medical affairs committee which post-mortems, why did this surgeon do this? So, you have to choose what is critical to your business. Of course, if I'm only thriving into a niche area of, say, service excellence, I may want to even have an app which allows me to read any magazine by a particular group, say Times of India or someplace across. I've seen that with Manipal. You just come, scan, you can read any magazine, today's newspapers, as long as you're in the hospital. In Manipal Whitefield, when we were commissioning it, if you're crossing my vicinity and somehow you were looking for an ENT appointment, not necessarily in my hospital, the AI providers across will actually trigger you a message that, hey, this and this appointment slot at ENT is available now.
Okay.
Even if you're crossing in a public transport just outside my hospital. So people have thought to those levels. There's a mini Google map, you enter in, it'll tell you go to the reception, turn left, third opening on the right is the OPD room you have to go to. So there's no requirement of a receptionist, and which also kind of tailor-mades, if I've prescribed certain tests to you, what is your order? Go to the lab first, then wait at the CT. Probably your waiting time is 20 minutes. So, you pick and choose what is critical to you, to your business.
Exactly.
If it makes sense. Thank you.
So many of the solutions you are talking about are more preemptive in nature, and that's very interesting. And some of the, but I'll come to the next speaker, Dr. Biren Chauhan, with the similar question. But my question is, while we are talking about some of these solutions, and again, the point is. How overall as a country, and when we are looking at this humongous population of 1.4 billion and addressing the health, how standardized it is, or is it still restricted to only certain super specialty hospitals? And so to spread it, become more mass oriented, I think affordability will definitely be one part of it. The other part would be standardization regime, some sort of standardization. So where do we stand there in your
Good
opinion?
afternoon, everyone. As my co-panelist, Commander Dr. Bali is there. Yesterday we celebrated Kargil Vijay Divas. So on behalf of everyone, we join you and wish you, as you represent the Indian Armed Forces, and we all are proud of our Indian Armed Forces. Right? Big round of applause. Coming back to your question, how about the standardization? I'll quote one example of country which is New Zealand, very tiny country. Few years back, they had a typical problem, huge waiting time. Patients were left to suffer because they were not getting dates for the surgery, even in the elective procedures. They come out with the equity adjuster scoring. It considered 4 things: ethnicity, geographic location, level of income of level or deprivation, and how long the patient has waited for his surgery. And they run the AI algorithms, they come out with the adjuster, and based on that, the patient was given the priority. The outcome was that after a couple of years, the mortality because of the patient waiting for to get themselves operated drastically reduced. And that's how the AI made a significant improvement in the health and well-being of the entire nation. Right? In India, so few days back we were discussing with the Quality Council of India and all. I give you example, some small village patient with an Ayushman card coming to a super specialty hospital, getting the angioplasty done, getting discharged. NHA reimburses the money to hospital, of course, after 2, 3, 4, 6 months, right? Then I went to the same village, inquired to the patient that, are you taking the follow-up medications so that your stent doesn't get, restenosis or something like that. That patient was so poor, he said, card tha isliye I went there and get the procedure done, but I don't have money to buy the medicines, right? And in that village, next to his home was the primary health center. In this entire picture, PHC was left out. Are you understanding? Right? PHC was left out. Then again, in Ayushman, to get the money, hospital is sending and registering all the documents digitally. We are submitting to the Ayushman board, the NHA and the concerned authorities. PHC also has a doctor and the internet connectivity, but nobody is sharing the data with anyone. Right? Imagine a scenario if there is a trigger that so-and-so patient from so-and-so village or so-and-so address getting discharged from the hospital for any of the procedures under Ayushman. And that particular nearest CHC or PHC or sub-center gets an alert. They are sending the, multi-purpose health worker or the, Anganwadi workers to the patient's home and ensuring the compliance. Imaging what kind of a good health or good well-being we can achieve in a country, right? So I think there comes the question of standardization. But before that, whatever we have to start sharing with each other, right? Private hospitals and public hospitals kind of a segregation cannot work in India, because now we have a lot of connecting platform of ABDM, Ayushman, insurance, IRD, everybody has a platform. Why can't we just start sharing the data, raising the triggers and making the change in the individual's life so that the health and well-being of the nation can improve, right? So that's it for the now.
Exactly. Very pertinent point you raised. And while you raised the challenge when you mentioned the PHCs were left out in the network, we heard the positive side of it in the morning when the AIMS Bhopal director was making the presentation, said how I think 50 odd PHCs from very Adivasi dominated areas were brought into the network. I'll come to Ekta next. The similar question, this gap, these health 4.0 technologies we can talk about, but how can this bridge this gap in healthcare access, how you access healthcare. What are your solutions, or not solutions, I would rather say the roadmap that you planned?
Thank you. So I think I can relate to this because I represent a medical college hospital, which is located in a rural area, which is away from the city, like 25 kilometers away from the city. And we used to have this question every day, like people don't have access, people don't have access to their records. Plus, 90% of the people we treat are from PMJY, that is the Mahayojana category. So a lot of brainstorming went into that, and we being the medical college, we do want to develop the future doctors also. So we developed a skill lab, which I think the idea was discussed in the morning itself. So we have a skilled lab which empowered the doctors, the students to have a grip on the patient care processes. Plus, a very brainstormed norm which I personally use in my operational excellence is AWATAD, that is AD, that is anywhere, anytime, any device. So with this thought in mind, we became the first medical college hospital to be paperless. I'm very glad to share that we have a paperless system at our hospital. Although we have 90% of our patients from rural areas, we have equipped trainings to them to have their records in their mobile. So the patients coming at our hospital are now having patient education videos in their mobile. How to take insulin is a very common thing, but we have videos filtered in the patient's device or the relative's device, wherein they can watch. Patient's education is on their fingertips. Their reports, their discharge summaries are on their fingertips. Because as Dr. Biren rightly said that the follow-ups, there are many loss to follow-ups when it comes to patient. So most of the patients will go to PHC or CHC or to the nearest clinic. And at times, majority of times we know, we don't get a file or a paper we want. That's a irony we all have to agree. So the PDF reports, everything is there in their mobile. Even
Okay.
the digital solutions coming up, we have integrated X-ray films and everything which can be scanned in their mobile. So I think by this, even their transportation is digital. Everything is digital. So when they come to the hospital, they are now seamless. They don't have to find anything. They even urge us कि हमारे पहले वाले जो फाइल के रिपोर्ट्स है वो भी आप इसमें स्कैन करके डाल के दीजिए. So I think that's a pure change which I see as a medical college hospital in a rural state of Gujarat. Thank you.
Okay, thanks. Saurabh, Gupta, I'll come to you next in similar question on the how this digitization or the health 4.0 or these technologies, however way you talk about improving the patient outcome and more importantly, bridging the gap that is there.
So first of all, thank you very much for inviting me here. Just for a second, I would like to visualize how the Health 4.0 hospital will look like. So there are three buckets. One is predictability, the other one is repeatability, and third one is extendability. So let's touch all three buckets. So predictability, and we have analyst panelists which spoke about things like IBM Watson. So that is of course tip of the iceberg, and now we are speaking about ChatGPT and other AI-based models. By the way, one day back, I think the Android and iOS application has also been launched for ChatGPT. If you have not installed it, please install it. By the way, ChatGPT is now as powerful as 70% of the human brain. So it processes over 100 trillion parameters. That is almost 70% of the human brain. So it is ever increasing. Now, as I said, three buckets. So the hospitals will be more predictable. It will run AI-based algorithms to actually arrive at a patient diagnosis and the probable treatment. In our organization, we have actually tied up with multiple companies. So 90% of our X-rays are actually scanned by an AI-based algorithm. And what happens is, you actually lessen the load on the radiologist. So at the end of the day, only 10 X-rays are there which needs to be examined by the radiologist. So you enhance the capacity. So the capacity is enhanced. The second thing is, as I said, in predictability, you also have patient. So we were talking about patient. There are a lot of black boxes in hospital. If you see from a patient viewpoint, so things like OR, ICU, a surgery was there for 3 hours. It has gone into 5 hours. Nobody knows what is happening. So we are also working, and there are some hospitals which have already installed a tracking mechanism in which you can actually see how the patient is progressing through the various steps. So that is predictability. You actually comfort the patient and patient attenders what is happening to the patient. There are, devices and apps which are available in the market which tell you, like in COVID times, there was a, app developed by my erstwhile organization which used to tell the daily parameters of the patient, and it was auto. So that is predictability, and it actually enhances the patient experience. Also, it allows to enhance access, because whatever we say, we have shortage of manpower, we have 75% of the facilities near the tier 1 cities, and now, of course, we are moving to Bharat, so people are moving into tier 2 cities. But whatever you say, with the pandemic, we have seen that this bridge will never be bridged. This gap will never be bridged, sorry. There will always a deficiency of people, manpower, as compared to the newer diseases which are coming. So technology is the answer. Because, telemedicine, of course, everybody talks. I am also talking about telemedicine. There was no business model. Now, majority of the follow-up surgery consultations in many hospitals actually happen on that. And the third thing is comfort and convenience. Basically, patient is empowered to actually consult from his home, to check his test report with the basic things. And with the advent of more and more digital softwares and AI-based technology, I am sure that, mood-based lighting, and there are many things which you can do to make the patient experience joyful and convenient in a hospital. That is about to come.
Okay, thanks for being so comprehensive. So I'll come to you, Dr. Anil, now. Now you have heard many of the healthcare people talking about how, if I may say, a smart hospital would look like in the future with adoption of more health 4.0 technologies. My question is, as a solution provider, how can you help these smart hospitals offer these next-gen kind of services, even as these hospitals sort of undertake a digital transformation?
First of all, thanks a lot. I mean, a light panel here, right? So I'm the only one from the solution side. So all of you against me. So I'll just speak about initially what we spoke here about, how is IoT, right? IoT market in India is currently 1.3 billion USD. In next 2 years, it's going to be 2 billion USD, right? What wonders me, I mean, I'm really shocked, is why are hospitals not getting into this business as such, right? Because the data which is generated out of that actually should have been in hospitals. Am I right? I mean, we open hospitals for clinics for sugar, kidney, hair, nail, everything, right? IoT is going to become IOB for healthcare in coming years. IOB is something like it will automatically detect whether you're wearing a mask or not, right? Right? And I also wanted to tell you that, when you have an IoT device, right, or an AI that needs to come in India, right, we usually study about outcome or value that you generate is always equal to quality by cost, right? In India, where we have a limited spend of GDP, right, for 1.3 billion people, I would bet all my houses on early detection of diseases, right, and prevention of those. I'm not talking about all the riches here who actually go and check your, every 10 minutes you will go back and check your, heart rate, SpO2, all of that, right? I'm talking about the actual Bharat, where 65% of the diagnostic tests that are done in radiology are actually chest X-rays, right? So we need AI to actually help entire Bharat to actually come out with AI solutions for detection of diseases, detection of tuberculosis, chest diseases. We spoke about it in the morning, right? That is where I think healthcare 4.0 is going to make a huge change there.
Thanks. Neelesh, I'll come to you next. While we have been talking about different aspects of smart hospital, the digital hospitals of the future, one important thing in the design of such a hospital is having the energy efficiency, the sustainable building, if I may say. So what are according to you, what are the things that need to be done there?
I will have to put in this way. If we consider any hospital, then if you say the electrical consumption of that, then HVAC heating and that constitute almost 50% or 55%, depending on how they are going to take care of HVAC side. But normally it range between 45 to 55% of the entire electrical consumption which has happened throughout the day. Then what is the next is like medical equipment. When I'm saying medical equipment, you consider CT, MR, anything, that will constitute only 9 to 10%. Other equipments which we use for OT, ICU, or which are there on the UPS, this is data which I am comparing with my 3 units which are there. And one of that has already got energy efficient award also for Ministry of Power. So I'm comparing that data only. So what is next is like UPS equipments, that is around 10 to 12%. And raw power or maybe the lighting is considered around 9%. This is the more or less if we consider this fact. So when we are designing something and when we are talking about net zero carbon or decarbonization, so what are things which is important? One is that HVAC. And when it will happen that during hospital construction, if we take care of that issue, then definitely energy efficiency is going to happen. Now, what is important, which is the one thing which is very, very common thing which we normally miss, is that normally the top slab of any hospital building is having maybe 6-inch or 8-inch, whatever the RCC slab. Normally we do waterproofing on that. Okay. Now there are 2 concepts. One is that over-deck insulation or under-deck insulation. If we do over-deck insulation, the U value, which is like we saw that thermal transmittance comes down drastically rather than doing under-deck insulation. Means first, over-deck insulation makes huge impact, so everyone has to do that. Maybe 100 mm, means 4-inch ka bhi ek layer, if you put it, it is going to make huge energy saving because that type of sunlight will not enter inside the building. Now, whatever the exterior side, instead of brick wall, if we do AAC block, definitely it is going to make a huge difference. Now, similarly, if you see medical equipment, now medical equipment, whenever we design, temperature and humidity plays an important role in any medical equipment. So everyone will say, any service provider will say, or equipment provider will say, humidity has to be maintained below 60% RH. So if you want to maintain it, either you have to use electrical heat stripper or you can have a hot water coil. So for that, instead of electrical heat stripper, if you use a hot water coil, it is going to make a difference. But now everyone is talking about digitization, everyone is talking about BMS. Now one point which I am going to tell you and which is unique and which I am doing in my hospital, if you see that, because I am basically a medical engineer, if you see most of the companies, they will say that the operational temperature requirement for CT scan, MRI, cath lab, LINAC or PET CT is 22 degree. They will say 22 degree is a requirement. Now we will set our temperature according to that 22 degree. But believe me, if you see that their main data sheet, that will say it is 26 degrees is also okay. Okay, so see the difference. Now if I'm putting on 22 degree for throughout 24 hours, I understand that 22 patient comfort, we require 22 degree. But when there is machine like CT scan, MRI, all these machine for 10 hours, it is not working. So can we put it to 25 degree? Yes, it is possible. And by doing that, now here the BMS has to play important role. We are talking about BMS, but it is not happening in that way. That it has to sense that there is nothing is there now, and it has to go up to 25 degree. And it will make huge saving as per the HUS is concerned. So these are the points we need to take into consideration. Then similarly, like CSID.
I'd like to maybe due to constraint of time, we'll take it up maybe offline the other point. What Neelesh had said, and on that I'll come to Bhupesh. We know Schneider is one of the global leaders in energy management. So in light of that, what is your vision of a connected and smart healthcare facility? And we heard Neelesh also talked about the design, the hospital design. So what are your views?
I'll take it from where Neelesh said. Primarily, I think BMS or HVAC happens to be one of the most important piece in any facility, irrespective of healthcare or any other building. So they consume most of the electricity. But I think when we talk what technology can help any facility like healthcare to be at peace is primarily a company like Schneider, which brings solutions, help connect all the assets in a way that they are able to deliver the performance for which they are designed for. So patients or doctor are not there to worry how the facility is going to be there. So you need to have a reliable power quality available so that the equipments are running fine. The patients are at peace that the procedures which are going to be performed in the hospital, they need not to worry. The doctors need not to worry whether the OT room will be ready or a reliable power will be there or not, or the ambient temperature, whether the relevant humidity or temperature to operate the machines and equipments are there. So that is where I think the technology comes very handy when it comes to the solutions what we can do, both on the energy side, even on the HVAC side also what Neelesh was talking on the BMS side. So this plays a huge role when it comes to delivering the quality of infrastructure what is required to deliver the services to patients for which they are visiting the hospitals. So reliable power primarily for the equipments and the environment primarily to perform the procedures. Patients, when they come, they may come for an emergency services or even for the planned procedures in the hospital. So they need not to again worry how they will be taken care in the hospital, whether they are in the room or moving in an OT room where their procedure is going to be performed or in the resting room and then going back to the room. So there is an interconnected system which can also get embedded in an overall BMS system which can take care of the movement of the patient also apart from managing the ecosystem of HVAC which is there. So today the BMS has expanded beyond the capabilities of only managing the HVAC system. You can integrate plenty of systems inside the hospital, be it your nurse calling system, be it your patient movement system or the OT room performances or the availability of these rooms for various procedures, including the maintenance facilities or the housekeeping, because after every procedure, the room needs to be sanitized and kept ready for the next procedure also. So all these systems can be digitized primarily to bring a lot of efficiency for the healthcare facilities, wherein companies like Schneider can come in and help those healthcare facilities to become the state of art and the best facilities in the country.
Okay, thank you. Commander Bali, I'll come to you again with a question on, we talk about Health 4.0 technologies and adoption. What are the ethical implications, according to you, of some of these adoptions, and how are hospitals able to address those ethical concerns?
Let me just give you a small scenario before I come to the actual question. 140 crore people, out of that 80 crore of us do not have any access to insurance panels or anything. 7 lakh beds today in the country, 30% more required as per the Niti Aayog. So that means 10 lakh beds. Let's say 50% of these are cash paying patients. At an ARPOB of 25,000, you're spending 120 crores every day out of pocket expenditure in our country. Now come to the connected healthcare paradigm, and let us say you have everything built in together. As far as ethics is concerned, I think we are centuries away from even thinking about this question I've never heard in last 8 years of my healthcare panels that I've addressed so far. So nobody has ever even touched about it. So that means, except for maybe the ethical committees that we have in our hospitals which look into many of these trials, etc., I think we are nowhere even thinking about it, as much as we are not thinking about sustainability and ESG. My friend Karan is sitting here from Apollo, and he does a lot of work in that. So I think we are centuries away from even, and today I think you've put this thought in my mind, maybe I'll go and look into the ethical part of IoT and AI. I've never thought about it ever in my lifetime. But yes, to just give a closing comment, the answer to India's healthcare problem is not about coming to the hospitals. We should not take pride in having 12,000, 16,000, 18,000 OPDs per day. I think we should take pride when we have no OPDs at all, or we have minimal OPDs. And I will call an Indian healthcare system connected when most of these things are happening remotely, where patients actually don't have to travel, don't have to go to hospitals at all, except when they have to be inside an operation theater or under a LINAC or under such a costly machine which you can't do at home. And that's the scenario, I think, which will happen maybe 5 years from now or whatever. But that's the connected healthcare that I sort of dream of. And I think that is the way India, because treating 140 crore people with the kind of GDP spend of 1.5%, having a tax base which is absolutely poor, this is never going to happen at all. Thank you.
Great. And thankfully, you have mentioned that such a connected healthcare scenario is likely to happen in 5 years, and that's not centuries away. Thankfully, I'll keep an open question. Anyone on the panel can take it up. Maybe ethical, as Commander Bali mentioned, might be raising the bar a little higher, but more on the, especially as we're talking more on telemedicine, teleconsultation, remote consultation. What about the data security, the patient data privacy and security on these aspects, especially when we are talking about next-gen technologies? How are these futuristic hospitals looking at that scenario? It's open, anyone can take it up. Yes, sir.
I take this question because just around COVID, when he was here, we were a part of a working group which was developing an app for the industry called as Swasth app. And we're proud to tell you that later on we submitted this app to Government of India. And now the National Health Authority manages it. And I was at Apollo in Bhopal in central India. And it was great to see that app, the developers were there with our hospital, giving us on how to document for Ayushman Bharat. And they were talking about how the data would remain confidential, how the data would flow between private and different sectors of the patient would have been seen there at Delhi and then would come down here at Bhopal and things like this. So when we were working on those lines, there were a lot of IT brains around there. There were people from, you name a hospital group chain, the CEO was there as a part of the working group. So they did ensure that the relevant data stays with them. The data doesn't flow to, say, probably companies which are going to develop products or maybe only extract data and counter sell it to somebody. But if it's actually working on to public-private partnerships or public domains where, maybe targeting only diabetes or breast cancer screening or, somebody who's early anemic or something to do with the diabetic retinopathy, neonatal metabolic disorder screenings, things like this, we wanted the data to be available everywhere so that you get to learn with riders about, there are 2 or 3 data which needs to be confidential as per statute, which talks about MTP, HIV reports. So those things ensure if there is a positive turnout, the data is just blocked out. And it's only the authorized one has to go through the supreme, whatever, channelizes there across, which the IT team, I think, would be in a better position to answer. But I think it is being addressed, it is being thought upon, and I feel probably not as far away, but surely around the corner.
Okay.
Right?
Yeah. First of all, I would just like to take a step back, right? We're all talking about 4.0, but honestly, hospitals, are our clinicians actually capturing and entering all the relevant clinical information back to the systems? A honest answer would be no, but for the sake of discussion, let us assume that yes, they are doing and we move forward, okay? Data security I've been hearing since morning, right? the first thing that we need to do is to have a third-party security audit on your data security, right? I would like to bring in an offer here. I mean, being very honest, please visit our booth. We would do a free of cost data security assessment of your hospitals, right? I'm with you on this, right? So my folks are already there. People also spoke about vulnerability testing, all of that, right? But in India, we always believe that, Murphy's Law. If something needs to go wrong, it will definitely go wrong, right? So let us look at it from a positive perspective. If something good needs to happen, it will definitely happen, right? All I need the hospitals to actually plan is, in case of a data breach, what is your response plan? Keep the document ready, right? We have, emergency cards ready in our hospitals, right? Code 0, code blue, whatnot, right? So let us have that. And basically, this is a simple document, but it's not as simple as people believe it to be. But in that, the basic component would be you define what is a breach, right? You define what is a breach, what is the severity of the breach, and who should report it. Incident reporting team. I mean, someone can't send it on a WhatsApp telling, email sab kuch bahar chala gaya, right? That's not the way. So you should have a process for it. You have an emergency response team, right, in hospitals. Same way, you create a data breach response team. What each of them need to do. And contamination, right? How do you contain, how do you contain a data breach, right? If it all means that you go to your server room, switch off all the lights, disconnect, please do it. But please keep it documented so that everyone in the hospital knows about it. The other most important thing is send notifications to the relevant legal and federal authorities who are supposed to know about any data breach, right? And the other thing which is very most important is have a communication plan ready for internal, right? Internal communication plan for your patients and for external world also. Put it on social media, you have all this template ready so that one click, you know where you are. That's all I'm going to tell. Please visit our booth and go in for a security assessment.
Anyone else would like to talk about the security?
Yeah. So I think as a healthcare delivery provider, service provider, even NABH, depends on the validation or certification like Microsoft or, AWS or anything else. I think data is generated in and around patient and more so from the hospital side, right? Even if the OPD, bedside, IPD discharge or the insurance claims or anything. I think there is a possibility for, Quality Council of India through NABH to define certain standards which the Ministry of Health or NABH body owns, and then those solution providers who are working in and around patient through hospitals or through clinics, I think they need to validate and, they need to be certified. I think there is a scope to have a subset of certification specifically for the healthcare provider or healthcare consumers.
Okay. Great. Yeah, yes, sir.
Just a comment from, from seeing the operations of our hospitals. So there is a behavioral element also in this, because apart from the security systems you put in, there is a behavioral training and the attitude change which is also required. So things like, what is your password policy? What is your password sharing policy? How soon it will expire? Whether you are allowed to share patient data on emails or it has to be in a, controlled server. So these things are also important. And I have seen, I think in one of the previous panel discussions, we are more than happy to actually discuss the data. But is that correct? And of course, we are not ready, but that is where the ethics come into picture. So it is more on the individual organizations also to define the policy on patient data, whether you are discussing as we are talking about NABH and JCI, whether you are, allowed to discuss it in the lifts.
Yeah.
Leave it. So that is also important.
Okay. And yes, you are saying something.
So I think when we are talking about all the data security and everything, we should also focus on the data that is generated for data analytics. As we discussed that whenever we want to publish anything, and if we search for the references, we always end up with the references coming out not from our country. So I think with this kind of data generated, we should also focus on how we can best use the data analytics, how far we can come up with the data of our own country. And I think a very common acronym which we use at our hospital is we should maintain the data perfectly. It's like GIGO, garbage in, garbage out. So we should also focus on the type and the quality of the data generated.
Great. Briefly, Neelesh, I'll come back to you. Very briefly, if you can mention the design part where you were earlier talking about. We talk about resilience of healthcare. How does that sustainable design take part of the...
I'll just hand over to him, but I'll have to leave. I have to catch my flight. I'm so sorry for leaving the panel, but the time is also up.
Okay, sure.
So when we are talking about patient safety, so patient safety starts from the, I can say from building of the hospital. Because all the fire safety we need to consider on day one. Then we are talking about infection control. But when it's infection control, then we have to have a proper air handling units, proper ducting, everything we need to do or take care when we are planning the hospital. So all these things are going to happen at the time of the, maybe your inception or maybe planning, that you need to look into that, all these aspects. That is very, very important.
Okay, and Bhupesh, you would like to add on the sustainability and resilience part of it?
So on sustainability and resilience, I think it is very important nowadays. I think that is becoming a very prominent topic, and we need to take care of our environment as we progress in terms of expanding our needs for the thing. So to achieve sustainability primarily for the healthcare, if I may have to talk again, I think we can work in blending the energy mix of the facility, which is through various energy resources. Again, I think we cannot avoid some backup power which is required being a critical infrastructure, but there are many technologies which have evolved, primarily the microgrid storage technologies which can offset the use of fossil fuels as much as possible. But again, I think blending of energy primarily from the green sources can help us achieve that much faster, apart from the efficiency measures what we embed in our ecosystem through digitization. I'll again touch on the topic of security and the data which we were talking in the previous discussion again. I think at the inception or the implementation of our digital layer, it is very, very important that we ensure that all the connected equipments or the communicating devices are fully cyber secure. I think that can be made a mandatory requirement when we are implementing those, even if it's an existing facility or a new build, whatever it is. So I think that is really important at this point.
Okay. So I'll conclude and I'll start with the healthcare providers first. 30 seconds to each of you. When we talk about a digital hospital of the future, on your roadmap, one action, very briefly, one action which you are likely to take in the next few quarters, if I may say, starting with you. One action, briefly, 30 seconds.
I think not one, but all our actions in future will revolve around patient and try to help the patient, be it saving patients time, be it improving quality or reducing cost. So everything will revolve in and around patient. I can't think anything else, away from patient happening in any of the domain, be it digital or the non-digital.
Thank you. I would just 3 words: clinical governance and outcome measures. That's all.
Yes.
Yeah, Narayana Health is now on the path of almost complete digital journey, is almost at completion. And we would like to see almost 0 OPDs in our hospitals.
Oh, that's great. Yes, sir.
I think automation and full digitalization, so that we can provide best of the patient experience. That will be the most important factor, and we are working on that.
Yes, Neelesh.
So digitization, considering that we are into healthcare and patient first.
So hospitals have already started moving outside hospitals, and we will try to be with the patient from start to end, and we will try to actually provide the services as close to their home. So that is the...
Okay. Okay, yes.
So from my side, I'll just add one statement. I think we should strategize, digitize, and decarbonize to make healthcare more sustainable.
Okay. Dr. Anil, you have the last word.
Well, my vision is a bit different, just to keep everyone to give out of the box thinking, right? Do you know in India, one of the biggest preventable disease burdens that we're facing is malnutrition, right? 14.6%, right? And that too, talking about it is really bad after having a good lunch, right? But even we are not left behind. High BMI, 3.6%. High cholesterol, 4.1%, right? How are we going to deal with this with 4.0 is the real question, right? I'm just going to give you one open, out of the box thinking. We have close to 100,000 ATMs which are working in India, right? Just imagine that you have a very secure, HIPAA compliant room, you have an AC, you have a backup, you have internet, you have monitor, everything. Just imagine if someone comes here and converts that entire thing into healthcare ATM where you can have a teleconsultation done. Automatically, SBI with more than 23,000 ATMs across India would become the second largest after the government to have healthcare setups. Thanks a lot.
Thanks. With that, we conclude this panel discussion. Or I can announce her name, Dr. D.K. Gupta. Commander Navneet Bali. Dr. Samir Singh. Neelesh Shinde. Dr. Biren Chauhan. Saurabh Gupta. Bhupesh Arora. Dr. Anil Muniyappa. I think Ekta maybe ma'am has to leave, or she isn't around. So just be there. We'll have a group photo. Please come.